All right, well, it is 2:33, the official time to get started per our guest. Our speaker today is Ellen Corman. She's a wonderful friend to our program. She has an undergraduate degree in occupational therapy and a master's degree in rehabilitation administration, and over 20 years experience in the field of injury prevention. Ellen developed and manages the highly regarded Farewell to Falls program, and she'll be talking with us today about that program, as well as fall prevention for those with PD and for all of us. Thank you, Ellen, for taking the time to talk with us today.
Happy to be here. So just a little housekeeping for everybody. We're in a webinar set, so I'm not going to be able to see you today. But if you have questions, please put them in either the Q&A or the chat. Denise will be looking at them and be able to share those questions with me. I'm happy to try to answer your questions when you have them.
Yes.
So can everybody see my screen yet? No.
Not yet.
Okay, so I just, hold on a minute. I forgot to do a share screen and now I have to move forward. Hold on. Let me see, get this going again. So sorry. Not
The nature of reality TV.
Okay, let's go back to the Zoom thing. We'll share screen.
There you go.
Okay, now
Perfect.
we'll start this. Okay, if everybody can see the screen, we'll move forward. As Denise said, I manage injury prevention programs over at Stanford Healthcare out of our trauma service. And the reason we talk about falls in that program is because the #1 reason that people have come to Stanford Healthcare trauma service is because they have had a fall. So I will be talking about falls in general, and you're welcome to try to ask me questions, as I said. So the first thing I wanted to do was have you take a look at your personal risks for falling. This is from the Center for Disease Control under cdc.gov, and it asks you a few questions that you can answer. If for every answer that you say yes, you get a certain number of points. If you score 4 or more points, it would mean that you were at greater risk for falling. So the first question it would be is, have you fallen in the last 6 months? And I wish I could see all of you so you could raise your hand. It's always helpful for me to know how many of you have fallen. The CDC the numbers say that about half of people who are 65 years, no, actually 25% of people who are 65 years or older fall. Each year. By the time you're 80, about half do. Certain medical conditions, of which Parkinson's is one of them, does increase our risk for falling. So I would assume if you joined us today that you have either fallen or have some fear of falling. As you go on with the questionnaire, it's going to ask you about whether you feel unsteady when walking, whether you use a cane or a walker to get around. Using a cane or a walker when you're unsteady actually is a very good thing. It helps you to be able to remain upright, but it also indicates for an evaluator like me to know that you have some strength or balance issues, which would require you to need that as a walking device. So cane or walker is a risk factor. Do you hold on to furniture to steady yourself when you're walking at home? Are you worried about falling? And going on from there, this is under cdc.gov/STEADI, stands for Stopping Elderly Accidents, Injuries, and Deaths. And if you, and you're also welcome to ask me for it, I'd be happy to send you a copy of it. So why do people fall? The best way to reduce falls is to be able to look at a multifaceted approach, because we know that falls are caused by multiple reasons. So we look at exercising, we look at medications, we look at our home for safety, we look at the health factors, behaviors, vision, even hydration. If you're dehydrated, we see the increase in falls, and certainly alcohol. And there's more. Just going to go through a few more indicators of falls. One of them is vision. And I always say that we use our eyes for our balance, and we use our eyes to be able to scan our environment. And so if we see something, let's say on the ground or on the floor, we can either step over something, step around something, so that we don't trip and fall or slip on something that's on the ground. So our vision is really important for us to be able to scan that environment. Another cause for falls is our gait or balance. So, and we're going to talk about that a lot more. So I'm not going to get too involved right now with that. Okay, why am I not moving here? Let's go. Here we go. More causes of falls. To the left is my dog, Mo, and he is my best friend, and I consider him not only a cause of a fall, a possible fall, but he's also my personal trainer. So he helps me to reduce falls as well. My dog is about the same color as my hardwood floors. So he can often blend into the floor, which means that I don't always see him, and he's easier to trip and fall over. He's a really good dog. The dog before him, when I would walk that dog, he would often pull on me when he saw a squirrel or a cat or something else, cutting me off of balance. So we do need to be careful with pets and be able to figure out how we can live with them safely. And there's I could do a whole presentation on them, but just think about those pets, the pet toys, where you keep a water bowl, how you need to go, are there ways that are difficult for you to bend and to be able to fill up in the water bowl and food, that kind of things, because there are often little solutions to be able to make that, to make it easier. Personal habits. We know that as we age, that we metabolize alcohol differently than when we're younger. Also, if you're taking medications, the combination of medications and alcohol can have really different effects. So it's really important for you to know how much you can tolerate comfortably, because drinking can really create a huge risk for falling. Medications. The rule of thumb is 4 or more medicines, whether they be prescription medications or even over-the-counter medicines. 4 or more contribute to fall risk. But the type, the amount, the combination, all of that could contribute to a greater risk. So for instance, sleep medications, antidepressants and antipsychotic medications, those medications are often ones that would cause dizziness and lightheadedness and drowsiness, and all of those can contribute to fall risk. So it's very important to talk with your doctor about your medications, especially if you feel lightheaded, drowsy, or dizzy. There are sometimes different kinds of, if you're having those kind of things, the doctor may be able to prescribe a different medication that's for the same symptoms. They sometimes can look at dosage that you're taking, time of day you're taking them. So don't try to change those meds on your own, but do talk to your doctor, because sometimes those can be altered to be able to make it easier for you to be able to live comfortably during the day. And then home safety. And I'm going to spend a bit of time on home safety, because we know that more than half of falls happen at home. Those with Parkinson's and other and people who are aging often have a gait that doesn't allow them to lift their feet as well, so they shuffle more. They may have poorer balance. So being able to make sure that you have nothing for you to slip or trip on in your home is a really high priority. So where do people fall? About 60% of falls are happening right at home. About 30% are public places, that may be church or your shopping center, even a doctor's office. And then the others are happening, it's nursing homes. I think of them as skilled nursing facilities, SNFs. So let's look at this, this first picture. And if you would do me a favor and look at the chat and tell me in the chat, one or two things that you see that could cause you to trip or fall. I'm going to give you a minute to answer that. Thank you, Ken, for answering. So Ken said that there was an extension cord. We see shoes on the floor there, the cane, as well as the cords. Yep. Any others? That rug, that throw area rug, I like that. I work a lot with the Santa Clara County Fire, and they always say throw rugs are meant to throw away. So we'll talk about that more. The newspaper, absolutely. Furniture's close together, and you're right, that gives you less space to move around and can become an issue as well. So all of those are fall risks and things that we don't always think about. We don't always look at it with the lens of being able to trip on them, especially if you haven't tripped yet. But the yet is the major word in that sentence, because if it hasn't happened yet, doesn't mean it won't happen in the future. So my rule of thumb is make sure you have the safest environment that you can have so that you don't have to test yourself each and every day. Okay, so I'm gonna so in this picture, we have a gentleman who's decided to work on his, maybe it's his taxes or he's doing a to-do list or whatever, and he's plugged in his lamp for a short period of time. And if we were working together on this, I'd be having you shout out again, but I'm going to save you from having to put in the chat, and I'll just tell you some of my thoughts on this. We often think that we are going to be fine. He may have plugged in his lamp, going to work, we'll unplug it, and he's all good. But the reality is that sometimes we don't plan for all of this. So he may have plugged this in, doing some work, and he has to rush to the bathroom, or somebody rings the doorbell, or something creates a reason for him to have to jump up out of his chair and move and go somewhere. And that cord now that was on the floor is in his way and could create a major tripping problem. So there's a couple options for this man. This gentleman could, if this was the only way he could plug something in, perhaps he could sit in the chair on the other side of that table so that when he got up and down, the cord wouldn't be in his way. A better way even might be for him to be able to move that extension cord and the lamp cord to his right, and to have the cord all the way along the wall that's behind his chair, and the cord itself to the lamp to the right of him, so there's nothing in his way when he's getting up. We always think we're going to be remembering, but then when we get up, we may not remember. So just think about and look around and make sure that your pathways are clear. Let's see if you can find some more fall risks. That beautiful bedspread on that bed could really create some issues. There's a woman in my neighborhood in her 40s, thought she was in decent shape, got up out of bed, tripped on her bedspread, fell to the ground, and incurred significant injuries from that. So we have to really think about aesthetics versus the ability to be able to make our environment the safest it can be. And having a shorter bedspread or comforter might have been a safer kind of bedroom for this person to be in. I'll say again and again, the small rugs can always be a risk factor. So this rug that's on the outside of the door is something that is easy to be able to find your foot underneath. My mother-in-law keeps on insisting on putting a rug outside because she doesn't want you to track in dirt. But I keep on going and picking up that rug and taking it away, and she finds another one to put there. But it's not really the safest thing we could have. But there are ways for us to be able to have things in our home that do make it safer. So the top left picture is a simple handrail for us to have to be able to walk up steps. So if you do not need a ramp, but you need some support getting up and down the steps, there are ways to be able to make them and install them so that they're aesthetically pleasant for people, but also are helpful for you as you're getting up and down those steps. On the right is one example of some adaptive equipment that could help somebody in their home. There's a grab bars that are for somebody who would be seated. That's considered a bath chair or shower chair. There are shower benches, but that's a shower chair. This one is a really great chair because you can walk right in. It doesn't have any lip that requires you to go over, but many times they do. So the best thing to do is have somebody really look at that shower with you. If you are stepping over something, then do you need a grab bar either right on the other side of the shower before you get in it to hold on to, or right into the shower to hold on to? And then once you're in the shower, is there a bar for you to hold on to so that you can safely maneuver and be safe in that shower? This toilet doesn't have any adaptive equipment around it, but sometimes having raised toilet seats or a bar on both sides can help us to be able to get up and down comfortably. And then on the bottom pictures, we have some rugs, and I'm not a fan of area rugs, but having a rug in a bathroom and in front of your kitchen sink, because slippery floors are not safe, then that's a good place to put rugs. But make sure that they have a really good non-skid backing. The one on the left does not. It's all just to look nice, but will slip and slide. So you either need carpet tape or a non-skid pad under it, but even better yet, be able to have something that has a non-skid backing on the back of it is a great way to go. If you wash those rugs often, the non-skid on that side can start to deteriorate. And so what was once really great and not slipping may start to slip. So check it every once in a while and see whether it needs to be replaced. I don't know where all of you live. I live in Mountain View, and our trees often come up and make our sidewalks get great big cracks. And so what happens is if you walk with a heel toe and lift those toes really high, then we often can lift our toes above the things like the cracks in the sidewalks or the area rugs on the floor. But if you end up having either shuffling your feet or walk sort of flat-footed, then your toe is going to be able to hit against those barriers, like those things like a crack in the sidewalk, and they can be very, very hard on you, and it could cause you to have a major trip or fall. So it's important to be able to see if you can do that heel toe. If not, you may need an adaptive device outside to help you lift your foot more. Strong legs, being able to lift those feet as you walk is really helpful in being able to help reduce your risk for tripping and falling. I'm not going to do exercises with you, but I am going to point out one exercise that I really like, and that's working on my ankle circles. Having strong and flexible ankles helps us to be able to do that heel toe motion a little easier. And so if you're sitting on a chair and you lift your leg and you draw a circle in one direction, and then you reverse that circle in the other direction, with both right and then left feet. That is helpful in the working on ankle flexibility, as well as a little bit of strength. So let's talk about exercising. The best exercise that anybody can do is one that you're willing to do regularly and ongoing. So I may like Pilates, but if I don't, and I don't like Tai Chi. So Tai Chi may be a great exercise for me. That's probably a bad one because it's such a good one, good exercise. Okay, bicycling. I don't want a bicycle. If we don't, even if it is good for me, if I don't like it, if I don't want to do it, then I won't do it. So my recommendation always is to find something you'll like to do so you'll continue to do it. And if you try one thing and you don't love it, try something else. What we want is exercises for flexibility, for resistance training, even aerobic. And bicycling is a great activity for people with Parkinson's. There's been a number of studies that have shown that it's can be really effective as going on a treadmill too. Other exercises though are Pilates, Tai Chi, dance. There's been lots more information in the last few years on rock steady boxing, and I believe there's one in Palo Alto, really local. So I have a friend who gave me some tips in terms of exercising for Parkinson's, and those tips were so good I wanted to share it with all of you. So regarding exercise for Parkinson's, she talks about talk to your medical provider, of course, to find out if you have any restrictions with respect to exercise. I can't emphasize that enough. That's whether you have Parkinson's or not. We all need to make sure that we should physically be doing any activities. But once we know that your doctor says, okay, and most doctors are going to tell you that exercise is good for you. It may be the type of exercise, the amount you can do, but most we're going to tell you that we all should be exercising. But you're going to talk to your medical provider. If you haven't exercised, then you need to start slow and build up your program. Schedule exercise time slots on your calendar. You're never too busy. And if you put it on your calendar, you can make time for it. Exercising with a family member or friend is a lot more fun. And consider if you're not good at being able to do things on your own, whether you can find somebody to take a class with. There's all kinds of great classes, the silver sneakers, the boxing that we mentioned. I'm going to talk a little bit more about a few classes that were offered at Stanford, matter of balance and bingo size. So in conclusion, exercise is medicine with no side effects. I think I should do a poster with that. Exercise is medicine with no side effects. It's good for all of us emotionally and physically, and you'll be surprised at what you can accomplish. So I appreciate those tips from my friend. So let's talk about behaviors. What are the decisions that we're making throughout the day? Are they contributing to fall risk, or are they helping us to be able to be stronger and more independent? So how do you carry things? Are you going upstairs and trying to put too much and carry and not have free arms so you can't hold on to a railing? Are you rushing around and always in a hurry? Do you drink enough liquids? Do you limit your use of step stools or ladders? And if I was in a class with you live, I love to be able to show some step stools. So I can only say, please never, never, never stand on a chair if you have to read something. If you have to read something, those grabbers are great things. Ask for help if you need something. Or if you have a step stool, use short ones that have a wide enough base so you can step on it comfortably and that has a handle for you to hold on to. If you feel dizzy in the morning before you get out of bed, you sit at the side of the bed until the dizziness goes away. So we say go from lying to sitting, count to 5. Go to the edge of the bed, go stand up. Before you walk, count to 5 or 10. Then start moving. Are you wearing open back shoes or slippers? I used to be a big wearer of flip-flops, but anything you can slip your foot into, your foot can slip out of. And so we see a lot of falls from that. Do you sit down when you're dressing or undressing? I have a colleague who lives in the East Bay who he's a fall prevention expert. And she was getting dressed one day, standing up, and she tripped and fell and broke her femur. So my bottom line from that, my lesson learned is when we're dressing and undressing, sitting down and being stable is a better bet. Okay, so, whoops. Sorry, my thing sometimes isn't moving forward. Here we go. Move forward. Here we go. So are you using your equipment? Canes and walkers are very helpful devices to help you walk safely. If a cane or a walker has been recommended to you by your doctor or your physical therapist, then chances are those recommendations are made because it is safer for you to be walking with it than without. If you don't know whether you should be using one or not, then getting a consult from a physical therapist may be a good idea. Do you have equipment available to make it safer and easier to do activities of daily living? And I mentioned in an earlier slide about shower chairs, about reachers. Bedside commodes can be really beneficial if you are getting up often and finding it more difficult to get to the bathroom safely. And home alert systems are important in order to get help quickly. So I'm talking a lot today about trying to prevent those falls. But if you should fall, those medical alert systems are wonderful in being able to get help to you. Changes can increase your fall risk. So if you have had a recent change in your medications, doesn't matter what kind, if you have change in your medication, it can affect how you are, how that affects your head. And in terms of, sometimes it just takes a few days to be able to adapt to a medication. So you may be lightheaded or dizzy, and that may only be a few days, and then you may be able to move on without those side effects. But right from the beginning, you need to be able to really look at what's going on for you and be able to be more careful during those early times. Illness or infection can cause us to be able to be weaker, to have other side effects. So we want to be able to watch for that. Pain can definitely contribute to that, and lack of sleep. Being sad or worried gets on all the lists, and I can't exactly tell you why that increases your fall risk, but it's on every list for fall. So I'm going to include it here too. And your activity levels are reduced. That's going to make you weaker. That's going to contribute to fall risk. If you moved recently to a new place, then being able to know where it is that there's little thresholds and different things like that make it more risky. And if you've changed your use of a cane or a walker, any changes can certainly affect your risk for falling. I'm going to move on to talk about some programs that Stanford Healthcare has, and you may have heard of these. The first one is called Farewell to Falls. We actually started this program way back in 2005, and it is a free community service that is meant to be able to look at the multifactorial causes of falling and then be able to help be able to address those. So we look at gait and balance. We do some sit to stand and something called a get up and go, and a few other assessments to test your gait and balance. And then we have a home exercise program that we share with you. that is evidence-based, but it's only really been evidence-based to show that for more sedentary older adults, it is not specific to people with Parkinson's or other neurological conditions. But we have shared the exercise programs with many people with Parkinson's and other neurological conditions who have told us that they feel like they've been very beneficial. We do a home safety assessment, looking at bathrooms and bedrooms and entrances in and out of the house and yards if you're using them, and all the rooms that are important and in use. And then will help you to be able to determine whether grab bars are necessary or other types of adaptive equipment. We're going to take a list of your medication, and that's going to be reviewed by one of our registered pharmacists at Stanford. And they look at it for the types of medications and the combinations of medications that you're taking. And we're going to talk to you about your behaviors, your shoes, and other kinds of things. There are 2 visits that are done by our occupational therapist. They usually happen about 3 or 4 weeks apart. To get into Farewell to Falls, you need to be 65 years and older, live in Santa Clara or San Mateo County. You need to be ambulatory, but with a cane or a walker is fine. You need to be cognitively aware so you can follow instructions and provide your own health history, but you can have support from a caregiver or others in the home. And then just be interested in being able to be in our full multifaceted program. So here's a phone number, and it'll be at the last slide as well if you're interested. It is a free community service, and I always recommend that if you think it could be beneficial for you, even if you've had an OT visit in the past or whatever, our focus is just on fall prevention, and we really may be a help to you. There's also some great exercise programs and fall prevention programs that you may want to consider. A Matter of Balance is a program that looks at fear of falling. It's an evidence-based program that was developed in Boston, out of Boston University, and it meets for 8 two-hour sessions with a lot of discussion on decisions that we're making. It talks about it as cognitive restructuring, so that we don't think of things that are always as scary, but that we learn what risks are good to take and what are not in terms of being able to move and be active. Matter of Balance is now we have 2 classes going on right now. One is virtual, and one of them is in person down at Sunnyvale Senior Center. So they're full and going on, but we will have another class starting in early April that you're welcome to be able to contact me about. Another program is called Bingo Size. And Bingo Size is our newest program. This was developed at Western Kentucky University, and it's bingo plus exercise equals Bingo Size. Bingo Size is a really fun way to be active and moving. We do it online. You get online, you get your bingo card, and we roll a few numbers, and then in between rolling those numbers and playing bingo, we stop and we get up and we do some exercises. We do some trivia questions related to fall prevention, and we have a really good time. So there are 10 weeks, 1 hour twice a week. So we have 20 sessions of Bingo Size. It's tons of fun. We have 2 classes going on right now, and once we're in the middle of sessions, we can't let anybody in, but we will be starting another class in April that we have funding for anybody living in Santa Clara County. So if you live in Santa Clara County, are 60 plus and want to play Bingo Size, you should get a hold of me. It's super fun. My biggest problem with Bingo Size now is people like it so much that they keep on wanting to sign up again and again. And I'm hoping to be able to bring some new people into the program instead of having us play, having all the people keep on joining again and again. The third program on this list is called Stepping On. Stepping On was actually developed in Australia and is now licensed by University of Wisconsin. And there are 7 two-hour sessions where we have a physical therapist introduce a bunch of exercises. We hear from a pharmacist and a vision specialist, and it's taught by occupational therapists. So it's a lot of experts who are talking together with you to be able to help you learn about fall prevention. We are on a break right now from stepping on, and we'll be starting one probably late summer. We've done them before at the Neuroscience Center. It's been very popular. So if you're interested in that, let me know. And then I hope all of you have been on our neuroscience supportive care site at Stanford Healthcare. We have some amazing programs, classes and workshops. We have dance for Parkinson's, healing yoga, exercise for PD, Qigong, sit and be fit, and there's more. So if you have not taken a look lately, they add programs all the time, and it's they're free of charge. They're a wonderful resource for everybody. So what happens after a fall occurs? So we don't want you to have any falls, but if you do, make sure you're checking for injury first. Sometimes we're really embarrassed that we fell. So we just want to jump up, or we want, and people around us want to just sort of pull us up so that we can pretend it didn't happen, that fall. But what we really need to do is stay down for a while, check for any injury. Did I break anything? Am I bleeding? Am I okay? If you need some help, make sure you call for help. Seek medical attention right away if you have a head injury, broken bone, or extensive bleeding. Call your doctor if you think you may have broken something or hit your head. Check for safety hazards. Look, say, how did I fall and why did I fall? Is there anything that I can do to be able to not make that fall happen again? And then, of course, see if we can learn how to get up safely. And remember, if you can't, that our 911 system, it does lift assist, and it is free for us. So if you do not think that you can get up safely, if there's nobody around there who can help you get up safely, then we can call 911. So I talked fast, and it's always so hard for me to be able to know what you're thinking. So I'm going to stop sharing my screen. No, I'm going to leave this part up because I think as a webinar, I can't see you anyway. And Denise, if you have want to share with me any questions that people have had, I'd be happy to try to address them.
I have a lot of questions. I have one comment. Somebody, just initial S, says, Ellen, in defense of your colleague who broke her femur, sometimes the reason for a fall is that the femur just broke with no warning. You probably know that, but just in case, wanted to share.
Yeah, no, that is absolutely true. For this person, it was her falling as she was trying to get dressed and hop into pants, and she didn't have the balance to really do that without holding on or being seated. So she made a bad decision when she was getting dressed, which caused her to fall and break that femur. But there have been broken bones. People with osteoporosis especially will find that they have a bone can break without a whole lot of movement.
Yeah. Let's see, I've got a couple of questions. I was going to start with the Farewell to Falls program. And one question was, you said you had to be ambulatory to qualify for the program. Does ambulatory include using a walker?
Absolutely. Walkers or canes are absolutely fine. We don't take somebody who's confined completely to a wheelchair. And that's not because people who use wheelchairs don't also fall sometimes in transferring and have reasons to have some intervention. It's just that our intervention is not really going to be effective for those people. But walkers or canes are totally fine.
Great. And then you mentioned something also about in the Farewell to Falls program, you can get support for installation of grab bars if needed. What does that mean exactly?
Sure. So we have some great resources to be able to share with you. If you own your own home and are low income, there's a great resource called Rebuilding Together. There's one for the Peninsula and one for Santa Clara County. I think it's called Rebuilding Together Silicon Valley and one Rebuilding Together Peninsula. So it depends on where you live. They will do free work in your home from grab bars or ramps and other kinds of of things, but you have to be the homeowner. You do have to be considered low income, but their low income levels are very generous, and they're a wonderful resource. We also have great resources for those who might, if you have the financial means to pay, that we work with a home safety company that is both accredited, and their people are licensed and bonded contractors, as well as having aging in place specialties. So they really understand people with older adults and people with disabilities. They're a great resource. They are not the cheapest game in town, but they really know their stuff. And so we recommend them a lot. A third, we'll never get in the way of you being able to use your own family members or handyman or whatever, but we will often help you before you bring in that handyman to be able to put tape on your wall or whatever to show you where a grab bar might be best suited. Because just looking at the studs on the wall may not be in the best place for you, depending on your height, whether you're hand dominance, all the things that are important for you to move safely. And sometimes a handyman is not always the right one to determine where something should go. But we can help you be able to tell somebody else where to put them, and then using a handyman or a family member who can do it less expensively can certainly be an option for you.
Yeah, you mentioned where to put them in the bathroom specifically. And then I have some support group members who say they have grab bars all over the house,
Yep.
Can you have too many? Can you put them in the wrong place as opposed to just the wrong height?
Sure. I mean, if they get in your way. So if they become something where you're going to bump into them, if your hallway isn't wide enough, or if the room does not give you the space to maneuver safely, then they can get in your way and therefore become something that you're bumping into and tripping or falling from. So that's certainly not good. But we use grab bars a lot in place, thinking about like the step into your garage. That's a place where there's often nothing to really hold on to. And a grab bar can be, the aesthetics don't often matter as much in a garage. So you can put a simple, inexpensive silver grab bar on the wall in your garage, and it can be so good for you, and you don't have to worry about it being fancy. But if you remember, sometimes the aesthetics do matter to people. So if you remember, if I can go back to that picture, where am I going to get like this? This type of thing on the outside is much more expensive to do. If you're going to have a nice handrail going up and down the stairs. So, and there's things that you can do in your house that some will be more aesthetic than others. Even grab bars and for your bathrooms now, you can have something that is a towel, can be used as a towel rack, but is actually a grab bar. I always say that if you weigh more than a towel rack wasn't made to hold your weight. Yeah. So don't use your towel rack for support, but you can put a type of a grab bar there to hold your towels, but also be strong enough to hold you. So think about where your needs are, and then what the aesthetics that you feel that you need to have to be able to put them in, and how close you need them from each other. Furniture walking is not always bad if you have the ability. Sometimes, is there something that's strong and sturdy for you to hold on to, so you don't need to put a bar in that place? Then that may be okay. But if what you're holding on to is not sturdy enough, then that's not a good option for you.
Yeah. You mentioned in the step into the garage, if you have steps in the front or the back of your house and you don't mind looking at the grab bars, is that also you really recommend having them there? Walking up and down this, taking a step up
I wouldn't say that as a blanket for everybody. It certainly depends on what your strength and balance would be. But oftentimes, if you have any strength or balance issues, having something to hold on to will make it safer for you to be able to go up and down those steps.
Okay. Let's see, we had another equipment questions. Ramps, portable or permanent?
It depends a lot on a variety of things. How long will you be in that home? How is this is this a long-term issue for you or a shorter term issue? Did you just have surgery, or is there so that you don't need to do something that would be permanent? And it depends sometimes on the cost. If you have a steeper stairwell so that you need a longer or more complicated ramp system, then that cost may be prohibitive to be able to pay for something to be put in, but may be more affordable to rent it. But if you need it for the next 15 or 20 years, you may have to do the math to figure out which one.
Yeah, those are good considerations.
Yeah.
So you said 65 or over to join the Farewell to Fall classes and program. Do you need to be receiving Medicare, or does Medicare have anything to do with qualifying for that?
It is a free community service that Stanford Healthcare offers. We do not look at your insurance. It doesn't matter if you're already getting physical or occupational therapy, because we're not billing any insurance. So that sometimes is concern to people, not wanting to, being afraid that it's going to interfere with the other insurances, but there won't be any problem for that.
Oh, terrific. And what if you live in an assisted living facility? Is that considered an apartment or?
Assisted living facility is okay if it is like a board and care or something where our recommendations probably will not have, the person will not have the ability to be able to follow through with any of our recommendations, then it's probably not a good use of our time and their time to do it. But if they have access to being able to make changes in their spaces, we're happy to come out.
Okay, great.
And it doesn't necessarily mean to, if you rent an apartment, you can often talk with a landlord to be able to make changes. And there are changes that we might recommend that wouldn't require drilling into walls or doing all of that kind of stuff too.
Right.
So don't worry about something being less, something that you're afraid to be able to make changes. You can often talk to your landlord too, if it will make your home a safer environment for you.
Are the occupational therapists going into people's homes now, or not?
Great question, Denise.
Yeah.
No, they are. Some people still decline. It's been a scary time for us with COVID, but we follow Stanford Healthcare's, all their protocols. All of Stanford Healthcare employees have to have both vaccinations and a booster. We are masked and gloved and follow some pretty strict protocols. We will call you prior to any visit and make sure you are healthy before we come in. And we are making our employees must attest to being healthy before they go out. So yes, we've been doing those visits. We only closed for a few months at the very beginning of COVID, and we continue now to be able to go out there safely.
Oh, that's great. And let's see, you said you can be using a walker, so we did that question already. I was wondering, sometimes you were talking about medications that make you dizzy or drowsy. Sometimes you have to take that medication.
Absolutely.
Other than taking it at bedtime when possible, or any suggestions?
So sometimes we always need to talk to the doctor, because sometimes it is the dosage. Sometimes things can be divided and taken instead of one time a day, maybe less, early and later or whatever. But it's not just about your being tired. It's all, those medications are very important in terms of your performance throughout the day, especially for Parkinson's. So we certainly are not telling you that to take it earlier in the day if that's when you it would be more beneficial. Anything that makes you really dizzy or tired, though, it's important then for you to understand how it affects you. And sometimes there are behavior changes that are required based on that. It's kind of like where I was talking about if you have low blood pressure and you get dizzy when you go from sitting to standing quickly, then we need to learn how to slow down and be able to, before we move, be able to sort of get settled in so that we don't jump up and fall over, because that dizziness gets worse if you move quickly instead of sort of settling into it. Sometimes there might be something like, there's some great adaptive equipment that can help you to be able to be safer. I love these things. I don't know if any of you have these, something that I think they're just called poles. They just go from floor to ceiling. They're just a pole. But being next to a chair or a sofa that's sometimes hard to get up out of, or bed, you know, to get out. And if you are a little bit lightheaded and dizzy, is sometimes just being able to have something sturdy to hold on to and be able to, again, sort of take a second and be able to make sure you're steady before moving, even before reaching for that walker or that cane or whatever it is that we need to use. Then sometimes it's just something simple like that, but it's understanding how things are affecting you, when they're affecting you, and then how to adapt to it.
Right, right. And then this is kind of the same thing when you said that if you make medication changes or changes to your assistive device that you're using, you can be a temporary increased risk for falls while you get used to the medication or the new device.
Absolutely.
And just, again, you just have to use those caution, go slow, get used to it, take it easy. Don't try to rush.
We know that there are certain medications that are so very important for us that we have to just live with those side effects. And that happens all the time.
Yeah. Let's see. My neighbor's elderly mother walked, but she didn't do any other exercise. And when she became elderly, she didn't have any abdominal or upper body strength to help herself in and out of chairs and in and out of bed. But the Farewell to Falls program has that strength training. Is that where you focus the exercise that you recommend? The ankles for balance, and then core and arms?
So the exercises are evidence-based, and some of them are strength-based, and some of them are balance-based. So walking, that somebody mentioned, they were just somebody who walked, and walking is an amazingly great activity for clearing our head, for using calories, for enjoying being up and around. And I encourage everybody to walk, but it doesn't work on your strength and balance, especially your balance systems. So adding balance to your activity is really important, but we don't always, so there are exercises like, one of the exercises that almost every physical therapist will ever tell somebody to work on, which is also part of our stepping on, matter of balance, and Farewell to Falls, is something called sit to stand. So if you are sitting all day and you don't get up, that's going to make you weaker. But if you are getting up and down, whether you call it an exercise and repeatedly get up and down, which is with sit to stand, or if you're just one who is just physically active anyway, so they sit down and then they jump up to go do something, and they sit down, then they get up to do the next thing. I mean, we're still using those same muscles to be able to work. I always say that one of the things that happens why older adults are more sedentary is that we don't have as many reasons to be able to be moving. So when you were younger and you took care of a family and you did lots of laundry and did more grocery shopping and took care of cleaning up, you were bending and reaching and turning and moving all the time as part of daily life. And you didn't call it exercise, you called it life. But as we retire and life has gotten so much easier, we have our remote controls and we have Alexa turn on the radio and turn on the music, and we don't have to move to do anything anymore. And as we sit and sit and sit, then we lose our strength and we lose our balance. So we do have to add it as an exercise program if we're not doing it as part of life.
Right, right. I have a request to put your contact information slide back up so people can write it down. And also, Kent says, the bathroom photo that's on the screen here illustrates a typical situation, hard to solve, but I'm not sure what he's referring to exactly. And he says, you mentioned a pole for a clog. Also, can use type mounted on the toilet. A pole or maybe a grab bar or something mounted on the toilet?
So there are so many amazing devices out there. So I don't know, I mean, in terms of poles on a toilet, I haven't exactly seen. I've seen like commodes that can either go over a toilet, that can be freestanding or go over the toilet, that have arm rests sort of on both sides that you can hold on to. You can easily put grab bars if you're, depending on where the walls are to your toilet, you can put a grab bar to be able to hold on to on either side or both sides for that.
I think that might be what he's referring to. In this particular photo that's on the screen right now, the toilet is not beside a wall on either side.
That's
so there's
correct.
Not any place to put the grab bar for the toilet.
That is
I think
correct.
he might be referring to, how do we put a grab bar by the toilet in this picture?
So you wouldn't be able to do a grab bar in this picture. You would have to be able to put one of those like commodes that usually go over the toilet. It makes it a little bit higher, and then it has arms on both sides to be able to. But there are, I was looking recently, my father-in-law just passed away, but before he did, he was having trouble getting on and off of his couch, which was low and cushy, and he getting up and down is becoming increasingly difficult for him. And I was looking at a pole, but I would also learn that there was something that's more of almost looks like a cane, but is located. You sort of put it underneath the cushion of the couch, and is something that's really sturdy, though, to be able to hold on to be able to lift off the couch. So there are all kinds of amazing devices. If any of you have an opportunity to look over at or talk with people at Home Safety Services, they're up in Burlingame near the airport, and they have all kinds of amazing, they don't consider themselves a durable or medical equipment company. They're more of just a home safety company, and they have just wonderful stuff.
Kent is asking, is there any grab bars that mount to like the same bolts as the toilet seat do to make it very stable?
I don't know that answer. I've never seen it, but it doesn't mean that it is not available, but I've never seen it.
And what is the name of that equipment supply on the peninsula?
It's called Home Safety Services. And that's the place that has these licensed and bonded contractors. They can put things like grab bars into fiberglass and into marble and in materials that some people are a little bit more worried about in terms of being able to know to do it safely and still keep their beautiful showers intact. But they also have a tremendous inventory of some great different kinds of equipment that could be very beneficial.
Yeah, Kent is saying that he does know there is one that attaches to that bolt area, so that it's very stable. So maybe the Home Safety Services, or sometimes these places like Home Safety Services, they have catalogs too, and they might be able to order it, something like that for you.
Yeah, I'm not sure, but yeah, they're a great resource. But I don't know anybody else around here who just does the home safety stuff. But some medical supply places also have a lot of equipment that's usable.
Yeah. Someone is asking if low toilets cause falls as opposed to a higher seat on the toilet.
So it all depends on somebody's strength. So if you have good leg strength, then you should be able to rise comfortably from a lower toilet. I don't know if any of you, years ago, I was in China. And the one thing I learned from that visit is that they have these squat toilets. They actually don't have a seat, so you have to squat. And I was saying, boy, you have to be really strong to be able to use a toilet in China.
Yeah.
And so I would say that the people there in older adults probably have stronger muscles from squatting like that. Squatting is an exercise, and we get stronger when we do it.
And in that case, it's life, right? Like you were just saying.
That's right. But for most, if we have if we have some form of a strength issue, then higher toilet seats just make it easier to be able to get up and down.
And there are those risers that you can put on the toilet. Those bolt through the hole with the lid.
Absolutely.
And can raise your toilet without having to replace the whole toilet.
Absolutely. And they have some really thick toilet seats. There's all kinds of ways to do them that are not that expensive.
Yeah. Anonymous says, what is your opinion of lift chairs? Because they rise you up with a motor so that you're not using those leg muscles. Oh, I can tell by your eyes downcast.
No,
blessing, aren't they?
I'm not I'm not a physical therapist, and I think that there might be mixed thoughts about that. I think if you have the potential to get stronger, then that everything that you do that doesn't allow you to do the regular activities of daily living that are also helping you to be stronger, that makes you then weaker over time. So it's the same thing I say about somebody who wants to use a wheelchair. If you need a wheelchair for safety and mobility, absolutely, they're the best thing that ever was. But if you have the ability to move without that wheelchair and can do that safely, even if it's like then a walker, you're using those muscles to be able to move. And so every time you use a substitute for something, then you're losing some opportunity to stay stronger. So for some people, at some points, lift chairs would be absolutely beneficial. So I would never say that you shouldn't get it. It just depends on where you are on the spectrum. That would be my opinion.
Yeah. Let's see. You mentioned that using an assistive device outside, if you're somebody who's not lifting their toes and you're getting caught on the edges of sidewalks and whatnot, or you were just referring to a walker in that situation?
Yeah, not necessarily just a walker. I mean, if you were, depending, again, it's always where somebody's at. But people use walking sticks, and sometimes that just gives you enough extra stability to lift your feet a little bit higher. Sometimes a cane. I often find that people who need a walker keep on trying to use something that looks and feels more acceptable to them in society, but sometimes is not really giving them the stability and help that they need to be safe while moving. So it really depends on where somebody's at.
Right. Let's see. Robin, who normally runs this group, asked, where did I put that question? Oh, I had it. Oh, do we know why people with Parkinson's are prone to falling? I would say that's multifactorial: freezing, blood pressure fluctuations, the balance issues that come along with it. Any other sort of things jump to your mind?
The only other thing that I would add to that is the walking gait that often makes somebody sort of shuffle. And I remember I mentioned that if you're not picking up your foot, then you're not able to lift your foot, every curb, every barrier, every threshold in a home. Just even going from tile to hardwood, and then hardwood to carpet. Every time you move, if you're not lifting your foot above it, that shuffling thing just means that there's more possibility of that toe hitting onto something and causing you to fall. But all those other things are absolutely true too. I mean, the freezing, the other stuff, yeah, absolutely.
Yeah, and we were just talking about how an evaluation to find out what assistive device is going to help you lift those toes is unique to each person. You need to have the evaluation and find out what's going to help you. So if a walking stick might work, is it kind of like the exercise you're willing to do? Does your profession sometimes say, well, let's go with the walking stick because I don't think this person is ready to accept a walker yet? Or, can you have that kind of negotiation in that situation?
Of course, we have to go where somebody's at. Like if you would prefer Tai Chi to yoga, but something or yoga to Tai Chi, it's what you're willing to do at the time. But it's also our responsibility as therapists to tell you what we think would be the best thing for you at this time. So you might like, you might like to do the treadmill, or you might say walking is all I want to do, but we may say, well, walking's great, but it's also, you should be doing, we recommend you do whatever. The type of professional though, who's really the best at being able to determine the walking and the walking aids is really a physical therapist. So I'm an occupational therapist, and my staff who come out for Farewell to Falls are occupational therapists. So we have a lot of expertise in being in falls, and we certainly see a lot, and we can make some recommendations, but good evaluation by a physical therapist if you think you're at a point of wanting some adaptive device for walking. The physical therapist would be a better person to really be in touch with.
And I've got another person who would like you to advance the slides to the end so that they can write down your contact information.
Of course.
So let's do that. And
okay, what are the questions? Sometimes my thing freezes. So let's see. Oh, here we go.
Yay. All right. So I have some big questions for you.
Uh-oh.
You probably know this one. Tips for getting people to use an assistive device when they either don't want to or keep forgetting. The universal question, right?
It is a toughie because, we all have some pride and we want to be able to be as independent as we possibly can. And sometimes, being able to depend on some device that isn't as socially acceptable out there feels uncomfortable. I think what we have to figure out though is what is the risk? And how, is it just it might be nice and you might be a little safer in doing this, or you're choosing not to do it. So, okay, you can get by with something else. Or is it that your strength and balance is significantly problematic? And by making a decision not to do it because of your pride or for whatever reason, could be causing you to be able to have that potential fall that will cause you to be in a much worse situation afterwards, where your health and mobility could decline to such a point where even that walker is no longer something that you would be able to use to independently get around. So it kind of really depends on where somebody is. Sometimes, a walker is a good idea, but not a necessity. And sometimes a walker is that you really got to do it, or else you will not be safe and you will fall and hurt yourself. So you got to know where you are in that spectrum, and you have to trust the health professional who's talking with you, but also kind of examine yourself. How much are you holding on to that? What does it really mean? Who are you holding on to? If you don't want to use anything, but you're holding on to your husband or your wife, and you are bigger than them or stronger than them, and you're asking them to be able to bear your weight so that you can hold on to them for your balance. How is that sustainable for both of you to be able to be safe to move around?
Yeah. Yeah, my aunt injured herself trying to help her husband get off the floor after he had fallen. She tore her rotator cuff for the second or third time. And, after they do that repair, the second or third time, they can't reattach it in the same place anymore. And she wasn't able to lift her arm all the way because it just didn't have the same angle. Yeah. I had a question from a friend who said that, she had bed rails on the bed for her mother, and her mother still climbed out of the bed. It was against the wall. She put a recliner on the side and thought, oh, she's really frail at this point. She'll never make it out the end or the foot of the bed. And she did, found her on the floor. So any comments about bed rails?
Bed rails are not controversial anyway.
Yeah.
Bed rails are controversial. I'm not an expert on that. I don't have a lot of experience with that, but I have seen people put the mattress on the floor so that there's less distance to be able to move, but then you have to be able to lower yourself onto that bed, which may or may not be a challenge in itself, right? I've heard of people, putting like foam, on the floor so it's safer, but that in itself then makes the floor a little bit harder to move on. There are options. There's probably some other people out there who could answer that better. Unfortunately, I don't.
Okay. Well, we tried. My support group had a conversation about non-skid socks versus shoes and slippers. Any opinion on non-skid socks?
Non-skid socks are good. I mean, as long as, the recommendation is not to go barefoot and to never go around with just socks that are not non-skid, because you can slip or fall. But non-skid socks are actually, I think that they're fine as long as they stay, some of the hospitals now, their non-skid socks, some of them have the non-skid all the way around, so they can't slip to be non-skid. But so you just have to make sure that you're wearing them and the non-skid remains on the bottom.
Right.
But no, they're fine. Slippers are, as long as people wear the slippers forever. So the more comfortable they are, the greater the chance that if they had any kind of grip, that it's losing it over time. So that slippers could become slippery if you don't. And so there's nothing wrong with slippers that are not slip-ins, the ones that actually can hold, that have a back to it, as long as they still have the grip on the bottom. Otherwise, you're better off to have a shoe that can your foot fits in, can be done up, and so you're not being able to have your foot slip out of something. Because anything,
we're all gonna go ahead.
Now, anything your foot slips into means your foot can slip out of.
Right. We're all gonna run home now and turn our slippers upside down and see if they still have any traction on the bottom. I was looking last night. There's a lot of alternatives for non-skid surfaces in a tub or shower. Tape and suction cup mats, bamboo decking, non-slip coatings. Do you have a preference?
I don't. I think most of them are non-skid, and as long as it works for you and your bath or shower, it's just important to make sure that they're there. And just like I talked about the rug that could lose its grip if you washed it too many times, suction cup. The bath mats sometimes lose their ability to keep its thing after many times of washing and using. Things get old and they do wear out. So as long as it still works, it's fine.
And if you put the tape on and it's all peeling up and it isn't actually there anymore, you got to put more tape on, I guess.
Exactly. Yeah. Yep.
Yeah. How about the I've fallen and I can't get up services? Are any of them better than any others?
There's a good oh gosh, now I got it. There's a really good website that can do some comparison. The medical alert systems have gotten much more sophisticated over the years.
Yeah.
So they now have GPS. They can follow you walking down the street or whatever else, so you can get help if you're a block away or somewhere else, depending on the service that you buy. So if there's somebody who's staying at home all the time and they're just basically going to be in the home, then it's a less expensive service than somebody who is more physically active and wants to be followed where they go. Stanford for years did the medical alert system through Philips Lifeline. And Philips Lifeline was also through part of Sequoia and El Camino Hospital. All those places had worked with Lifeline, and it's still in service. They do a really, really good job. And Stanford doesn't have it in-house anymore. They sent it out, but it's still a good product, but it is no longer like one of the only exclusively good products out there. There's something called Great Calls that I think was sold at Costco. I don't know if Costco's still selling it. There's a whole bunch of different companies out there now. I suggest that you Google best medical alert system, because I don't have the name of it in front of me right now.
I found one called Best Reviews, and it says medical alert systems comparison. It's a chart, but I don't know who publishes that, and they may have be selling something in particular and steer you in the wrong direction.
I was looking to see if I had my. Oh wait, okay. I think I have the site that I always refer people to. Hold on, I will find it right now.
That'd be great.
Okay, check out, and maybe you can put. You want to put it in the chat, or?
Yeah.
It's
what's it called?
seniorliving.org/medical-alert-systems/best.
Okay.
And they have a comparison of a variety of ones by price and what they can do for you. You also, the Apple Watches now can have, the commercials will show you that they have an ability to detect if you have fallen, and they can call somebody for you. And I believe that there are other watches out there that can do that as well. So there's just more product available than ever before. But they're only as good as when you wear them. So the problem with our medical alert systems is that we often fall in the shower, or we often fall at night.
Yeah.
And so sitting on your dresser while you have a fall is no use.
The watch is not a lot of help. Yeah, that's
right.
True.
So for any of those devices to wear, wearing them around their neck, around their wrist. So you have to
really
be
good for hiking. Yeah.
But you have to be committed to any of the medical alert systems that you're willing to that you're getting. If you're at risk for falling, then you need to be able to make sure that you're wearing the device.
Right. That was the problem with my aunt. She got it and it lived in a drawer. Not helpful. Yeah. Let's see. I was wondering where caregivers can get some training about how to help their person that they're caring for to transfer safely, chair to bed, toilet to chair, or to help somebody get off the floor so they don't hurt themselves like my aunt.
Yeah, it's a great question. You just stay in touch with caregiver support groups, and sometimes they'll invite in experts to talk about it. That I've heard there's this wonderful occupational therapist who works at San Mateo General, who's done some talks on that before. Her name's Sarah Eggers Thornhill, and she's terrific. But I don't think she has like a regular class or a regular series. I just, heard her do caregiver talks before. So there's a lot of them. I don't know anything, any ongoing regular class.
Yeah. What is her last name again?
Thornhill, Eggers, Eggers Thornhill, Thornhill. And Denise, I can give you her contact information. She's really awesome.
Yeah, great. Robin already probably knows her personally, but it's a new name for me.
She's an occupational therapist. She works for San Mateo General and has a thing called OT house calls. So she does home visits and stuff, but I've seen her do that specific talk, which is just much more, she does a better job than I could in a lot of those real specific transfer skills and that kind of thing.
Yeah, well, I know that these falls lectures really do make a difference when the training, because at one of our conferences that we did many years ago, the person doing the presentation talking about helping somebody who's unstable on their feet and to stay behind them so that when they go down, you can put your knee under their butt and be a chair until you can lower them slowly to the ground so they don't injure their head or anything else. And I didn't expect to ever need it, but I was present, I was listening. And my mom was taking a beta blocker, got up the first evening she had it, got woozy on the way to the bathroom. And I said, I'm just going to go with you. And I was behind her, and it worked like a charm. When she went straight down onto my knee, and I called for my husband, and we lowered her to the ground and just let her get her bearings. And then, she was fine. But you never know what you pick up in these falling classes. It could really help somebody from becoming hurt.
That's awesome. I love those kind of stories.
Yeah. So we're Denise, just about 4 o'clock. We got to go.
Yeah, I think so. I'm happy. My email and my phone number is on this list. I do not consider myself an expert on Parkinson's or other neurological conditions. I would say I'm a little bit more of an expert on fall prevention for the general, more sedentary population. But if you have any questions for me after you get off this and think of something, I'm happy to be able to answer or find the answer for you.
All right, thank you so much for your time and your commitment to answering future questions. Have a fabulous afternoon.
Thank you so much.
Okay, bye everybody.
Bye-bye.